Hello everyone, I'm Sonal Chandalia. I'm the Chief Nutritionist at the Diabetes Endocrine Nutrition and Management Center in Mumbai. Today we are going to delve into understanding what about weight loss when one has obesity or one is overweight. One always wants to know that how do I go about it? It's one of the most simple and pertinent questions that everyone has when they're trying to undertake weight loss. So let's look into what is body fat and what is the body mass index, which you may have already heard about from everywhere. What we need to understand is that as Asian Indian population versus the Caucasian population, our fat percentage in the body is much higher than the Caucasian counterpart. In fact, we are a poor lean body mass population, and hence we have to actually work harder to bring about that weight loss in the form of fat loss. So what we really need to understand when you undertake any kind of weight loss program is that you need to bring about the fat loss, not only the total weight loss, because it is more meaningful to lose the fat, which is actually the risk factor for many diseases. And once we look into that, you actually have achieved far more. It is extremely important to know that when you lose the lean body mass, you're causing greater difficulty because your protein content of the body also reduces. So please remember that when you are undertaking any kind of weight loss, it has to be fat loss. So usually as per studies and what is practically and scientifically allowed is to lose about half a kg of weight in a week, which is considered most ideal, which leads it to be about 2 kgs a month. So overall, a loss of about 1.5 to 2.5 kgs or maximum up to 3 kgs from your body weight in a month is considered healthy. Any kind of weight loss which is very rapid may not be clearly advisable and in fact can be quite detrimental if it is done way too quickly. So let this pattern of weight loss in the form of fat be in small trenches that go along. We do not want it to be erratic and have it very fast at one point and then very slow again, which can happen as the natural body pattern may tend to plateau at times. So it's important to nudge it and budge it at every step and quite a regular, slow yet correct weight loss in the rate of the weight loss that we want. Now, there are many weight loss strategies that may be present, but we need to understand what is the meaning of set point and settling point. In the life cycle of a human being, which we all face, whether from childhood, whether as an adolescence, whether in youth, middle age, and as an elder person, we know that there is a set point that the body weight has. Usually we are discussing when we are talking about undertaking any kind of weight loss, that what was the set point of an individual prior to before they were about an adult. So that would be at the early youth phase where you tend to defend that body weight because it is predetermined, you're in a constant environment. But we don't tend to take into the factors of life that happens because life happens. Either there could be some incident for which reason or some kind of situation in life where you landed up gaining weight from that set point, or it could be pregnancy in women where their weight changes drastically. So we need to also take into consideration when you're undertaking any kind of weight loss program with your healthcare professional that the body will not defend that set point, but it will go ahead to defend the settling point. This settling point, as we call it, is a specific body weight level, which is your point now from where you will tend to go towards that because of your changing environment, even though your genetic factors are constant, because your environment has changed over time. So kindly keep this in mind and try not to go down drastically, like trying to lose 40, 50 kg straight out, where people say that I need to go back to my set point. That is highly ideal and that may not be possible in your lifetime anymore. So please work towards your settling point at this particular juncture. So once one has undertaken the journey of weight loss in the form of fat loss, the important point is that yes, the challenge being that I lose the weight, but my challenge being that I have to keep that weight off. So it is not only about losing weight with the correct rate of weight loss, but it is also important to remember that the long-term weight loss maintenance has to be kept in mind. And in fact, when you do a slow and correct rate of weight loss, you will be able to maintain the weight loss that you have undertaken for long term. When you tend to do it very rapidly and very quickly, you may tend to yo-yo and go back to your original weight that you will regain that weight. So remember that when it's slow and steady wins the race, because we see even from earlier data and when we are treating our own patients that the weight regain can occur in the first 2 years after you've made all the effort to get that weight off. So there can be a failure rate as high as 90%. That's why it's extremely important to go slow and go correctly with the right behavioral habit changes along with that weight loss in the form of fat loss. So sometimes it's not only about losing the kgs, but it's also very important to remember when you do the right rate of weight loss, it's about losing the inches. That also means that you have achieved the fat loss, and that's an important point to remember when you undertake this journey. So friends, the weight loss and the weight loss maintenance targets should be known to you. It is considered even a successful outcome if you lose about greater than 7% of your current weight that you are holding. And you'll find that even that amount of weight loss will help in reducing your risk factors by close to 45 to 50%. Which is a huge result that you achieve, because your risk factors being cut down close to 50% is a very difficult target otherwise to achieve in a lifetime. But with this lifestyle change and undergoing fat loss, that can be achieved. And we also find that usually the stable weight of a person, once they do not regain the weight in the first 2 years, they'll be able to actually maintain it quite well once they go beyond that barrier of 2 years. And close to about 3 to 7 years and beyond, you'll find that your weight will remain stable and the diet and the lifestyle that you're following becomes almost like a lifestyle pattern for the rest of your life. So do remember that once you undertake it, the weight loss maintenance becomes the next key step that you need to look into, and you need to make sure that you can stay stable at that particular weight. So when you are undertaking this journey along with your healthcare professional, remember that you have to adhere to the diet. We no longer live in a world where you are a non-involved or uninvolved submissive individual who's only listening to your healthcare professional and playing a passive role. We all individuals today play a very active role in maintaining our health. So it is important for you to know that adherence is the key. You're an independent, intelligent, and autonomous decision maker. So you need to play an active role with your healthcare professional in the plan, in the journey that you're undertaking, so that you get the best results and the best outcome for yourself. So finally, do remember, friends, that the human being defends their body weight far better against food scarcity, which means in drought as well as in famine, versus food abundance. We are far less efficient in maintaining our body weight against the plethora of food that we tend to consume, and hence our body metabolism actually tips to be more detrimental. So we are far better when we try to eat a little less than the level of fullness that we normally feel, and slight undereating is always better than overeating. So with this take-home message, I would like you to know that apart from taking care of the rate of weight loss and the slow and steady manner in which you have to lose weight, you also need to know the amount of nutrition that you're getting. Make sure all the food groups are included, all the macro and micronutrients are included, and a hypocaloric diet may work better than complete starvation. But at the same time, we need to make sure that we get the right nutrition in the process. So thank you for listening in and wishing you a mindful and healthful weight loss journey.